Hello, I am Dr. Kirti Shankhdhar, consultant obstetrician, gynecologist, and colposcopist from Surya Hospital, Chembur, Mumbai. I have an experience of more than 24 years, and my expertise are colposcopy and high-risk pregnancy. Today, I'll talk about effect of age on fertility and pregnancy. Ideal age for having pregnancy is from mid 20s to early 30s, although pregnancies beyond these limits are very common. More common in today's scenario is advanced age pregnancies than teenage pregnancy. Today, I'll cover first challenges of advanced age pregnancies, and towards the end of the talk, I'll talk about teenage pregnancies in brief. Starting a family is a personal decision. Rate of couple having their first pregnancy in their late 30s is increasing every year. One of the benefit of having pregnancy later in life is having more life experiences and financial stability. Advanced age pregnancy describes as pregnancy where age of the pregnant female is more than 35 years. All pregnancies come with risk, but advanced age pregnancies are more at risk for complications. In spite of this fact, it is possible to have healthy pregnancies and healthy babies even after 35 years of age. Then question comes, why advanced age pregnancies have more complications as compared to normal pregnancies? There are two main reasons behind it. First is like you are born with a set number of eggs in the ovary. As your age goes up, the number of eggs in the ovary goes down. There's a big decline in fertility from mid to late 30s in form of quality and quantity of eggs, and you are more prone to have diseases like fibroid, endometriosis. All these things together has an impact on the probability of getting a healthy pregnancy. Even if you conceive, then because the age of the eggs are more, you are more prone to have chromosomal abnormalities. Down syndrome, which is one of the most common chromosomal abnormality, the probability of having Down syndrome is roughly 1 in 1500 pregnancy at the age of 20 years, which increases to 1 in 350 pregnancies by the age of 35, 1 in 85 pregnancies by the age of 40, and as high as 1 in 35 pregnancies by the age of 45 years. The second common reason for having complications is because as you age, the probability of having chronic medical conditions increases. All these conditions have a direct effect on pregnancy and delivery. Even a non pregnant person is more prone to have high blood pressure at the age of 35 than at the age of 25. Then, what all complications may happen in these patients? Of course, first and foremost is preeclampsia. The meaning of preeclampsia is pregnancy induced high blood pressure. The second commonest is gestational diabetes, again, pregnancy induced diabetes. The probability of having preterm deliveries, low birth weight babies, and twin pregnancies are also high. Because of all these factors, there are more chances of cesarean deliveries. Then, as I said earlier, more probability of having chromosomal abnormalities in kids, more chances of having miscarriages, as well as more chances of stillbirth. That means death of the baby inside the uterus before delivery. Now, if all these things are happening, what can we do? How should we manage these pregnancies to decrease the probability of bad outcome? Genetic screening is recommended for each and every pregnancy, but it is very important for the pregnancies with advanced maternal age. These are the reports which are done with the help of sonography and blood test at around 12 weeks of pregnancy. If any problem comes during genetic screening test, that time we do confirmatory invasive testing for these patients. These testing include chorionic villi sampling, where the cells from the placenta is taken for the confirmation of genetic disorder, or amniocentesis, which means putting a needle through the abdomen inside the uterus to take out the fluid around the baby and checking the cells from the fluid to confirm the genetic diagnosis. Otherwise, also, you are supposed to visit your doctor more frequently. You need to do all blood testings, a little more blood test and early blood test to find out any condition. You have to do more sonographies to find out the baby's heartbeat, the proper growth of the baby, and all. You have to go for all the prenatal visit, follow your doctor advice, try to maintain healthy weight gain by eating healthy and regular physical activities. Now, if you are a couple of advanced age and you are planning for a pregnancy, what should you do before pregnancy to get proper outcome? Here, I'll advise to go ahead for a preconceptional checkup to rule out any existing medical illnesses. If something is there, it should be under control. Prenatal folic acid is important. Along with that, you have to maintain a regular physical activity, quitting smoking and alcohol, taking adequate diet in form of fruits and vegetables, lean meat, whole pulses, and quitting smoking and alcohol is equally important. By doing all these things, you can improve outcome of pregnancy even at advanced age. This covers in gross about advanced age pregnancies. Now, the other spectrum of pregnancy is teenage pregnancies. The incidence of teenage pregnancy is around 8% in rural India and 4% in urban India. The reason for more teenage pregnancies in villages are because of the early marriages, lower socioeconomic conditions, less education, and less access to contraceptive practices. While making love in adolescent age is the most common reason for adolescent or teenage pregnancies in urban India. Like advanced age pregnancies, these pregnancies are also complicated pregnancies. The main complications here is in form of anemia, like less blood, then preeclampsia and eclampsia. Again, it is pregnancy induced high blood pressure, which may even get converted to fits and convulsions also. Then infections at the time of pregnancy and post delivery. Along with that, these kids are also prone to have preterm deliveries and low birth weight babies. All these things together put these kids also at the risk of more cesarean delivery as compared to normal pregnancies. This covers in gross about both the spectrum of age related problem during pregnancies and fertility. Now we end our session over here, and you are welcome to ask any question if you want to ask. So Mehul is asking why there is high risk pregnancy with age factor above 35 along with diabetes. So diabetes in itself is a risk factor for any pregnancy. Even if it is at 25, then also we consider it as a risk factor. Diabetes is associated with genetic defects, chromosomal defects, and birth defects in the babies, as well as probability of having, uh, you can say, towards the end of pregnancy, it may end into fetal death inside the uterus. We have to have a check in the diabetes level even before a lady is planning to conceive, even at the age of 25, forget about 35. The diabetes level should be in check. That rules out probability of having defects in the baby. The most common defect with diabetes is heart defects and even the brain defects also. So it's important to keep the diabetes in check before pregnancy, during pregnancy, and post delivery for uh, allow for the sutures, either it's a normal delivery or C-sections, to heal completely. Then it's Ashish asking, Ma'am, high TSH levels can also lead to abnormality in pregnancy. Hello, Ashish. Yeah, thyroid is very important. High TSH means a case of hypothyroidism. Hypothyroidism in itself may lead to infertility, like the probability of getting pregnancy is less in these patients. The high TSH level may lead to abortions and you can say decreased fetal growth. There is a possibility of having little low mental development if the TSH is not in range. It's very easy to control TSH levels by giving few medications. So if it's a known case of hypothyroidism, the level should be controlled before pregnancy, and we need to check the TSH level throughout the pregnancy at 6 to 8 weeks gap, because as the need of the body and pregnancy increases, the need for thyroid hormone levels increases, and the doses we need to titrate the doses throughout the pregnancy. Then Mehul is asking why there is high risk pregnancy associated with diabetes. I think we have already answered this question. So, any other question? So, there is a question ki what preventive measures should be taken by both, like the men and women, as a couple to prevent complications of pregnancy? So, I'll say that you should go for a pre-conceptional checkup. For the female, it is important to get the things checked so that I'm doing all the blood reports to find out any existing medical illness which is otherwise being missed. For a male, it is important to have all the reports as well to get a semen checkup done. The other things you can do is like by maintaining the ideal weight, by doing regular exercises, by taking good meals, as well as quitting alcohol and smoking. It will be helpful to improve the outcome of pregnancy. Then the other question is like, is there any way to determine fertility beforehand to plan pregnancy in advanced stage? Yes, we have a few tests to determine the ovarian reserve. The meaning of ovarian reserve is to determine the quality and quantity of eggs in the ovaries. First and foremost important is serum AMH level, which is a blood test. It can be done any day of the menstrual cycle, and the levels of AMH is very important as far as the egg quality and quantity is concerned. The other report is another blood report, which is serum FSH, which should be done in the beginning of menstrual cycle, like second or third day. Then a good sonography in form of antral follicle count, again on day 3 of the menstrual cycle. These three tests together gives us a clear idea about the ovarian reserve, and you can plan for the pregnancy like that. And the other Naina is asking, is it preferable to store eggs earlier in time and plan for pregnancy in late 30s or so? So I'll say yes. If you are sure that you want to delay your pregnancy for late 30s or early 40s, it is a good option to think for preserving the eggs. Ideal age for preservation of eggs is in late 20s or max by early 30s, because the quality and the quantity of eggs are great at that period of time. Then Visma is there. She's asking if I have PCOS, should I plan earlier? Hi Visma, yes. If you are asking if you have a PCOS problem, you should plan for the pregnancy early, because PCOS patients are more prone to have premature ovarian failure, as well as they have difficulty in inducing egg follicular studies, and it's preferable to plan early pregnancies if somebody is having polycystic ovary. Then Jayashree is asking, what are the some possible risks of getting pregnancy later in life? So, because of the aging, chromosomal abnormalities in fetus is more, as well as miscarriages are more in later life, and because of the growth of the body or whatever, the with age, there is more probability of having chronic medical illnesses in form of diabetes, high blood pressure. These things together put the baby at risk of low growth, and of course, the probability of having twin pregnancies and premature babies are also high. Then the next question is, if one, how careful should one be with work and activities in advanced pregnancy? So, of course, towards the end of pregnancy or third trimester, which starts after 28 weeks of pregnancy, you need to take proper care of yourself by avoiding strenuous exercises, strenuous activities. As well, you have to be careful about the supplementation. You have to visit your doctor very regularly, every 15 days, and you need to keep the things in check. Taking regular diet as well as having a rest of around 8 to 10 hours is equally important. That much you need to take care about it. And last question is, like, is the chances of cesarean delivery is more? Or if the other person is asking, what are the chances of normal labor, or should one try for normal labor in advanced stage pregnancies? I would say no. If you are not having any indication for cesarean delivery, advanced age in itself is not an indication for cesarean section. If you are healthy, your baby is healthy, there is no other indication for cesarean section, you are very fit for normal delivery. With this, we will end today's session. If you have any query, if you want to ask any question, you can put in question box. We will get back to you later with answers. Thank you.